If you know maternity signs, you can answer a question on maternity. There is always a sign associated with maternity condition, from pregnancy, labor, complication, postpartum. There is always a sign. In this short crash course, I'm going to give you all the conditions and specific signs you should pay attention to when you answer the question, either case study or standalone question for the NGN. Let's get to it. Stick with me. Let me make this easy for you. First thing, we start with all the things that you already know. Signs of pregnancy. Why do we call it? Because that's what they're going to ask you. They're going to ask you signs of pregnancy. We have what? Presumptive signs. You have to know them. Exactly is presumptive. That means this is all about the mother. Whatever they're telling you, that's all you listen to. That's how you can remember. What is that? If they tell you they've not had their menses, that's a sign of what? Presumptive pregnancy. Or if they have nausea and vomit, that's your sign. If they say their breast is tender, that's your sign, right? These are what? Presumptive signs that the mother will tell you. Or breast enlargement, right? You should know this. I know you know them. Or the areola can darken. So you see dark areola. That is a sign. They can get fatigue. These are all presumptive because the mother is telling you. Don't forget, urinary frequency. That's another clue. And this one, most people forget, quickening. When they tell you, I can feel the baby moving between 16 to 20 weeks, that's what? Presumptive sign. Another one you should not forget is the skin changes, right? Linear, Niagara, and chloasma. These are all presumptive signs because they are changes the mother will tell you, and they will tell you about it because it's occurring in their skin. These are presumptive signs. If you know them, when they ask you which sign is this, whether you're in nursing school, you can ace it. First thing down. Second sign of pregnancy is what? Probable. That means what? What does that mean? What is the definition of probable sign? I call it vital signs. We're doing vital signs. This is examined by the provider, something the provider can do. And the provider can feel the uterus, can feel the baby through the uterus. So they can do certain physical exams and they can come out with something. When they focus on the uterus, there's so many things they can do. When they tell you the cervix is what? Soft, they're talking about what? Goodell sign. If they say there's a bluish discoloration of the vagina or the cervix, they're talking about Chadwick. If they say the lower uterus is what? Is soft. The lower uterus is soft. Then that means the ego sign. But if they said the anterior portion of the uterus or in the middle, the mid-anterior portion, where the fallopian tube joined the uterus, this is what we call what? Laden sign. All these things, you should know them because these are easy points to get. If they get a blood test and they say you are ACT positive, what do you mean? It's a probable sign. If we do Braxton Hicks contraction, probable sign because it goes away when you move. Or ballontement, when the baby just keep on jumping up and down, right? The feeling that you can feel is all probable sign. So these are little things. If you know these signs, most of the questions will be based on that, and you got to figure out and you answer the question easily. That one is done. These are the little things I want you to pay attention to. And then positive sign, that means imaging. We're looking inside the uterus with something to give us some idea. Either we listen to the baby heart tone, right? That is a positive sign. I can feel a baby. I'm using ultrasound to look inside the baby, and I'm feeling movement, right, by the doctor. These are what we call positive sign. I'm trying to make it the way so that you can understand it. This is the easy way to understand these kind of signs. So that's all you need to know about signs of pregnancy. Does that make sense? I hope so. Now, when you come to labor, they're going to ask you certain things. Is this patient in labor or not? So you have a true labor and a forced labor. I will do true labor, and then you can figure out the forced labor. It's straightforward. You're going to talk about contraction. Is this contraction regular? Is when there is contraction, there is what? Effacement and dilation of the cervix. That's all. Is the cervix changing? Does this pain goes away when you move? And where is the pain starting from? From your lower back to the front. That's all. And does it increase in intensity with time? If you say yes to all of this, contraction, regular, effacement and dilation, pain does not go away, lower back pain to the front, and there's increase in intensity with time, this is true labor. If I ask you forced labor, what do? Those are signs of forced labor. Forced labor means contraction is not regular, effacement and dilation doesn't occur, pain goes away, it starts from the front, it doesn't go anywhere, and the intensity doesn't change. It's the same. These are signs of true or forced labor. I want you to focus on that and use these signs ideology, and you can answer a question on maternity because that's what they're going to ask you about science regarding maternity specifically. Okay. If we talk about placenta, the placenta also can get into trouble. You can have previa of the placenta. I'm dealing with just the mother. I'm not talking about preconception. These are specifically when you're pregnant. Right? And previa, what you see is going to be painless and the blood is going to be bright. There is no uterine tenderness and the baby fetal heart rate is normal. That's your sign. These little things, if you take care of it, you'll be able to, even in case study, you know what is going on. And if I said there's abruption, you know what to tell me. It's going to be painful, the blood is very dark, and the uterus is going to be rigid. Baby is going to have B cells. Little things make a mountain. And when you know that, you know complication. And if I say the uterus is in trouble, you know what you're going to say. You can say uterine what? Rupture. What is that? What is one word you're looking? I'm giving you the buzzwords. I did not want to call it buzzwords. I call them signs now for this particular video. But they are the buzzword. Cessation of contraction, right? And the loss of fetal station. Those two words is what you're going to take with you. And you know this lady has uterine rupture. You don't need to know everything. Little information. If I say this is a uterine rupture, you know there had to be cessation of contraction and a baby loss of fetal station and a fetal distress, like deceleration. You got it? Now, let's go to condition that the mommy will complain about, preeclampsia, right? There should be one thing that comes to your mind: hypertension, facial what? Edema, not your leg, and then proteinuria. These are little three things. When you hear in the case study, you know that's a buzzword. Of course, you're going to have headache, right? There can be visual changes, but you don't need all of them. These little things should tell you that, oh, this is preeclampsia. And if I say the patient is having eclampsia, you know what is happening. You know patient has already have preeclampsia. That means he has all of this already. And therefore, what you're looking for? Seizures. That's all. You're looking for patient is already having seizures, or they are in coma with preeclampsia. That's changed to become what? Eclampsia. Simple, straightforward. Now, if I want to trap you, I would say preterm labor. Well, that's not a trap. You already know. What is labor? Just add the things we talk about labor, right? Regular contraction. Cervix is changing. Effacement is happening. Pain starts from the lower back to the front. Intensity increasing. But what is that? This occurs at 37 weeks, less than 37 weeks. That's all. You see what I've done? I've defined preterm labor for you. Buzzword. That's how I call it. For this video, I'm going to call it signs. Preterm labor, you are in labor, and it's less than 37 weeks. And it's going to happen, all the things you know about labor. Bring their content together. And then when I put P in front of it, I said premature rupture of memory, right? Or prolonged premature rupture of memory. You know what is it? That means your memory is not supposed to rupture, and it's already ruptured. And therefore, what we're going to see, something is going to come out, gush of fluid. And then you got to test it to make sure it's amniotic fluid. You do a nitrogen test. What color are you going to see? Look for blue color. Anything other than blue is wrong. Or if you don't have color litmus test, you use finding. Look under the microscope and look like it's finding with finger-like projection. That's premature rupture of memory and a prolonged premature rupture of memory. What is the increases want you to know of this? Number one thing you should know, infection. That's all. So protect the baby from infection, antibiotic, all the things you have to do. Maternity, I'm trying to make it easy as much as possible. I have a bunch of videos on my free of charge. You can watch it. I want you to be comfortable because this is a topic that always disturb people back. You have to make it small as much as possible. You heard about shoulder dystocia. What did you hear about it? I want you to focus on one word. Bad word, one sign, turtle sign. It's like a turtle. That means the head retract after it's been delivered. If the baby head come out, it's not supposed to go back in. If you go in again, that's shoulder dystocia. What is your priority? Deliver the baby as much as possible. Time. And what do? Mark Robert. And what is the strategy they're going to trap you with? Is what? No fundus pressure. Okay? It's suprapubic, and then flexing of the leg to the abdomen. That is Mark Roberts maneuver. No fundus pressure. If you do that, you get it wrong. There will be a situation where you have amniotic emboli. The mommy is delivering, and all of a sudden, they will tell you this amniotic embolism. What do you think you should see? Number one, respiratory distress. When mommy is delivering in labor, they should never have the respiratory distress. If they have respiratory distress, they'll give you a case study, delivering respiratory distress. Number one, amniotic fluid emboli, blood pressure, and the mommy will go to shock, cardiac arrest. So they need to be intubated quickly. Blood pressure go down, they turn blue, cardiac arrest. Do something. I know you're seeing what I'm trying to do. I'm trying to you to understand this easily. Another sign, maternal fever. Mommy has fever. The uterus is tender. What do you think will be? And then you have foul-smelling loci. What do you think? What do you think is going on? Maternal fever, right? Maternal tachycardia and fetal tachycardia. You can say maybe endometritis or chorioamnionitis. These are all related. When you're looking at this, you can see that these are some of the things. Or you can say this is endometritis, depending on which condition, right? Or which time this is occurring. These are the things you have to figure it out. When it comes to postpartum hemorrhage, what are you looking for? Postpartum hemorrhage. One thing, right? They have to be a boggy uterus. The pad has to be saturated less than an hour. This is enough for me. If they give you heavy bleeding, well, they will not give you. They will give you those signs that you know these are a problem. And therefore, this is postpartum hemorrhage. If they say the patient has postpartum infection, it's different, okay, from chorioamnionitis or endometritis. This one, the fever has to occur more than 24 hours. You see, that's the buzzword, right? You look at, has to be smelling, foul smelling, right? The uterus is still tender, and there's fever, right? There's fever, but it's different because the pain or the fever occur after 24 hours. Did you get it? So those are the little things I want you to pay attention. In the case study, they will give you this. Pregnant lady, first trimester. If you do these signs, case study will be easy. First trimester, right? And what is the thing? Spotting. And then the patient has what? Unilateral, lower abdominal pain. I don't have to tell you what is wrong with this lady. Pregnant, first trimester, spotting, unilateral, lower abdominal pain. What is that? Ectopic pregnancy. I can put a bunch of words on it, but I've given you what the NCLEX will give you in a case study. Straightforward. And when you need it, that's all. If I want to make it interesting for you, I will say shoulder pain. What would it be? The side where they have the pain. If they have left lower quadrant pain, they're going to have left shoulder pain. If they have right lower quadrant pain, they're going to have what? Right and shoulder pain. So depending on where they are, if it's the left, they're going to have left shoulder. If it's the right, you're going to have right shoulder. That is what? Ectopic pregnancy. And when they come to postpartum, there's a blue, there's depression, and there's the word psychosis. If you are blue, you will look like depression, but it's not. They're very tearful, they're irritable, but they can go about doing their own thing. Normal activity, they just have mood swings. And these go away by like 2 weeks, it's gone. They can function normally. They are not hopeless. They don't lose interest in anything. When you hear loss of interest, right? That is anhedonia, right? Or sadness. That takes a long time. Yeah, that's the problem. Or suicidal ideation. And they tell you they're hopeless. That's depression. And if they have hallucination or they're paranoid, you know that's psychosis. That's all. Blue, just counseling. Depression, counseling and some medication. Hallucination, you get admitted to the hospital. These are signs, I call them signs, but at the same time, buzzword for maternity. If you know this, these little things I've given you more than 15 topics the NCLEX will ask you in a very short form. If you know these signs, in the select or apply question, that's a breeze. If this video helped you, thank you. Just make a small comment, subscribe to Adapt NCLEX for more content like that. Good luck, nursing school, and the NCLEX on maternity nursing. Thank you for watching.